Welcome to this course about how to treat LGBTQIA+, or the sexual and gender minority community in 7 slides. I am Jay Cafretta, and I will be your host. This micro course is intended to be a brief overview of some ideas that you may not have considered about treating the SGM community. Oftentimes, I hear providers say that they're happy to do it, but feel unsure about how to go about it and don't want to offend anyone. This is great, very respectful, but we still need providers to treat the SGM community. This course will give you a basic understanding of what treating an SGM individual entails. It is not a deep dive into the medical care of these patients, but rather a focus on things we might call social determinants of health. The topics we will be covering in this micro course are introductions, like names and pronouns, the context of healthcare setting from the patient's point of view, primary care, specialty care, mental health, religious exemptions, and your social identity. So let's get started. Let's talk about introductions and pronouns. These are the folks we are talking about. These are the terms most folks are familiar with. However, that being said, it is also a limiting definition of two very complex aspects of our human condition, our sexual identity and our gender identity. For those of you who have never felt anything but cisgender and heterosexual, it's hard for you to imagine being any other way. And that is true for the folks in the sexual and gender minority community as well. We cannot imagine being anything but who we are. At this time in history, with politicians deciding if transgender and intersex patients and women have autonomy over their bodies, it's important to remember that if you are scared as a professional, imagine what it is like to be victimized by the government and the medical system. There are many identities that have existed in the past as well as now. This is not a new thing in our civilization or our species. How we view it is our problem. In the animal kingdom, as they say, there are many gay, lesbian, bisexual, transgender, and intersex animals. There are even left-handed ones. Now, pronouns are important. You would be surprised how offensive it is to be misgendered. Try it sometime. Try seeing what it would be like if someone addressed you by the incorrect pronoun. If you do not want to use an incorrect pronoun, out of respect, the name that someone uses is always the best choice. Names are also important, and if you were named after a long-lost relative, you may feel the pain of that name and choose to use a nickname. And you probably feel pretty strongly about that. You can imagine how easy it is for people to just call you by your nickname, like Al and not Adolf, or Aloysius, which also happens to mean famous warrior. For trans folks and others who want to choose their own name, it can be easy for you to call them by that name, even if you have to pretend it is their nickname, whatever it takes for you to be respectful and use the name they have chosen rather than what may have been on their identification. In Nevada, we require a mechanism to retain the name for insurance identification and chosen name all in the medical record. Respect means calling someone by name, not hey you or some other name. This is very common with names from other cultures when we don't know what name to call someone as they have 4 or 5 names or it is pronounced in a way that we are unfamiliar with. Most people will agree that pronouncing a name is vital in establishing a rapport with the patient. Any effort and every effort can be made to start out on the right foot, so to speak. What is it like to access healthcare in today's political climate, where healthcare is being denied to patients in multiple states? And where a woman is now, as in one state, the law does not require an emergency room to save a woman's life over the pregnancy. Thereby, they both die. Right now, understanding the context of healthcare setting is to understand about access, knowledge of appropriate care, violence at the hand of a provider, denial to cover care financially, family issues, and minors. And again, this is not intended to be a deep dive into any of those particular topics, but it's just a way for you to start thinking about how the patient perceives the healthcare delivery system in terms of these things. And you can look at my other videos to learn more about some of these topics. When we talk about primary care, which is what most folks need, every system in the body is considered primary care. All bodies have the same needs for primary care. That's what we're talking about in terms of an annual checkup, checking your lab work, looking at where you are in terms of your age and your health condition. Do you have chronic illnesses or conditions? And remembering that SGM folks have the same issues. And just as a reminder, endocrinology is primary care. That is the management of your hormones. Everything from when you're a baby all the way to the last day of your life. Endocrinology plays a part in how you experience the healthcare system. Now, when we talk about specialty care, then we're talking about things like surgery and an awareness of medical history. But again, surgery is the only specialty care that we can really discuss when we're talking about trans and intersex patients. Medical care like a DEXA scan for osteoporosis is important. So when is a transgender man a female patient? Well, when he is a postmenopausal female in terms of his physiology. The patient is a he, but the reading of the scan must be for a postmenopausal female. The parameters for men getting DEXA scans is something quite different, and making sure that a pap smear is given to a transgender man is important. Why? Because it's another place where trans men need the additional nuance of a postmenopausal female. And trans women still need a hernia check and a prostate check for the entirety of their lives, regardless of their actual physical anatomy. In terms of mental health, for many transgender patients, the ability to access surgical transition requires a psychological evaluation with a passing recommendation for the surgeon. Some surgeons will not provide surgery unless this mental health check is complete. This is another burden or step that trans patients or even intersex patients have to pay for, and insurance companies, even though they are requiring a letter, won't pay for the mental health assessment. Finding a provider that is aware of the issues and concerns that must be addressed for these patients is another aspect where provider education is so important. To access hormones may also require a psychological or mental health check, but a postmenopausal female would not require that in order to access estrogen. These issues with hormones are principally focused on trans men around the controlled substance of testosterone, but trans women also face bans and denials despite having the same levels of hormones in their bodies that a typical female of a particular age group. A cisgendered female can opt for surgery without any mental health check, and all reconstruction post-mastectomy is required to be provided by any medical provider being paid for by an insurance company unless it is deemed that it's a trans woman or a trans man. Then that surgery can be labeled transition care and denied. And again, remembering that this psychological evaluation sort of implies that all LGBTQIA plus people are mentally ill. Now, I would like to also just add the caveat there that not every person who wants to transition surgically is a good candidate. There may be other comorbidity issues to be considered, like in terms of things like cardiac health and other systems that may need to be addressed as well. When we talk about religious exemptions, these are the kinds of things that make these issues a little more sticky. For some folks, this has to do with a blood transfusion, but that is the patient. When we talk about providers, that is a different exemption. That is an exception to the rule of best practice for certain patients or people. These exemptions are based on the provider's spiritual beliefs on not the best practice of medicine. Almost all of these exemptions revolve around the SGM community and not really any others. And although anti-Semitism is another place where someone who is Jewish could be discriminated against if a claim of religious exemption were sought. Broad religious exemption laws, RFRAs, sometimes called Religious Freedom Restoration Acts, permit people, churches, and nonprofit organizations, and sometimes corporations, to seek exemptions from state laws that burden their religious beliefs. The individual person or organization must seek out an exemption, such as through court proceedings. Targeted religious exemptions provide a blanket exemption or license to discriminate to anyone operating in a specific area, such as child welfare services, medical care, businesses serving the public, or government officials/employees, solemnizing marriages. It seems children and the LGBT community are the only ones denied healthcare on religious reasons. And again, many types of child abuse and maltreatment have been justified on religious grounds. The only faith-based medical neglect is protected in statute, especially for children. Now, again, when we're talking about providers, we need to talk about you and your social identity. Why? Because you are just as important as who your patient is. Your social identity comes with its own baggage. Patients judge you before you walk into the room, too. And building trust in a medical relationship is a primary concern and even a skill. People, patients will not follow your directions if they don't trust you or believe you. And we know what happens then. Bad outcomes are the result. So, in conclusion, looking at these different aspects of how treating a transgender patient, an intersex patient, or any patient under the rainbow banner or the sexual and gender minority community is important for you to think about these different aspects of how healthcare impacts their lives and how it impacts your medical practice. Thank you again for taking this course. Please contact me, j@asltraining.com, with questions, comments, or additional material. Remember, ASL Training, adult sensitivity learning has your training needs covered. Thank you again.